As we were discussing borders of the lungs in the previous video, so let's continue the topic. Borders of the lungs, these are dorsal and ventral. The dorsal border is anteriorly thin and posteriorly thick, and right lung is greater than left lung. So this was the part which we already discussed. So the ventral border is thin, sharp and shorter than the dorsal border. There is presence of cardiac notch, and I also told you that you can use this point of left cardiac notch and right cardiac notch to differentiate both right and left lung in your exam. Ventral border is thin, sharp and is shorter than dorsal border. There is presence of cardiac notch from where pericardium is exposed, and left cardiac notch is larger and present at the third to fourth intercostal space where pericardium of heart is in contact with the wall of thorax, and right cardiac notch is smaller than the right. The right cardiac notch, it is smaller than the left, as the left cardiac notch is larger, right cardiac notch is smaller. Apex of the lung is placed within the cupula pleura. So do remember this point. This is also important for exam. This cupula pleura is important point. So apex of each lung is placed within the cupula pleura. Apex of left lung is more or less pointed, and apex of right lung is much larger, rounded, and occupies the space in front of the heart and extends to the left side. Base is concave and is molded on the thoracic surface of diaphragm. The base of the right lung is more concave due to the placement of liver at the other side of the diaphragm. This surface is oval in outline and bounded by the basal border. So this was all about the apex, base and borders of the lungs. Base and apex is already discussed, and bronchial artery is also called nutritional artery, and pulmonary artery is the function artery. You can use these 2 points. These are also important for exam. You can get match the following or any filling the blanks from here. So this was all about the lungs. Structure of lungs, there is external serous coat, serous areolar tissue is present, and external serous coat is formed by pulmonary pleura. Elastic fibroareolar tissue is present, and each lung is divided into 1000 lobules. Pulmonary substance is present, and each lobule is divided into terminal bronchiole, which is divided into respiratory bronchiole. Here we wrap the topic of lungs in this video. If you find these videos helpful, then do subscribe my channel for more such videos. Thank you. See you in next video. Bye bye. Take care.